My name is Jillian, and I am the functional practitioner here at Reverse Institute. I use this short video to explain what it is that makes our program so different and why it brings so much healing and success to so many. It really is a 10-step process. Obviously, the first step needs to be signing up, which you can do on our website by clicking on Get Started. Once we receive your information, you will be receiving an email with a link to fill out our symptom burden assessment. This assessment takes approximately 20 minutes to complete online and will ask very specific questions relating to your current diet, your past diet, current and past medications, along with hundreds of symptoms that you may or may not be experiencing. Once you submit your assessment, I will be able to review your answers and create a symptom burden graph, very similar to the one you see pictured as an example. This graph gives me a snapshot of a person's current health status and potential issues. In this particular graph, you will see that the large intestine, sugar handling, vitamin need, pituitary, and thyroid systems are all in emergency mode. This chart by no means is meant to diagnose. It simply gives me a baseline and a starting point. Once I have had the opportunity to review your symptom burden chart, usually 2 to 3 days after submission, you will be contacted to schedule your consultation. This consultation can be done online via video conference or in clinic, but no phone consultations are permitted as seeing a person visually is imperative. It will be during this consultation where you will be able to review your results, discuss your current health, your goals, and any previous attempts at resolving the issues presented. It will be at the end of this consultation where you will be able to decide if you would like to proceed with either the online or the in-clinic total health programs. If you choose not to proceed, that's okay, and we will be here if you change your mind. If you choose to proceed, the cost for this part of the program will be applied to the total health program. If you decide to proceed, HTMA testing will be the next step. This testing is included in the cost of the full program, and it is mandatory. The information this test will provide regarding the status of your current health and what the potential issues may be is invaluable. In this picture, you will see two very different profiles with very different nutritional needs. One of these people is a very fast metabolizer, the other is slow. One shows an excess estrogen production and needs to avoid calcium. One of these individuals needs vitamin A and the other needs to avoid it. One will benefit from vitamin D supplementation and the other will suffer if they take vitamin D. One of these people should absolutely not be participating in any HIIT type exercise as it will make their health much, much worse. So these pictures just represent a portion of what the HTMA test results can represent. But this is exactly why diet and exercise programs need to be implemented strategically, or they could be menacing to your health, and yes, even exercise. The live blood analysis provides more insight as to your body's current state, things like parasitic infections, uric acid buildup, protein maldigestion, and much more. Unfortunately, this testing is only available to the in-clinic program participants. Once the HTMA test results have been reviewed, a meal plan will be created that incorporates the HTMA findings and your goals. Let's say, for example, the HTMA test finds that you need magnesium. I will create a meal plan that is targeted to that specific need, and you will receive an invitation via email to access your meal plan, similar to this one. The meal plan software is easy to use and it will absolutely change your life if you let it. Here you will see, as an example, a few items I've suggested for this person for Wednesday. You will also see notes that I've left and the nutrition information for the content above. This is where things get really great. Notice in the top right-hand corner the ability to create a grocery list. Once you click on the Create Grocery List, a full list of items will appear, and depending on which dates you chose, every single item will be involved from every recipe that was on your meal plan. If you choose to just choose today, you can also create the grocery list for just today's items. In the top right-hand corner, you'll see the Go Mobile button. This is pretty great because it will send the grocery list directly to your cell phone. So as you're walking through the grocery store, you can click on each item you've obtained one by one and they will disappear, making life super simple. I cannot say enough great things about this software and the opportunity it presents. Not only will you receive a meal plan suggestion from us that directly targets your health concerns, but you can create your own with the click of a few buttons. You have access to our entire database, and you can even import a recipe you find online and add it directly to your meal plan. This service is free to all full program participants for the duration of your Total Health program. On top of the meal planning software, each person receives access to our health reporting software, and again, it is free for the entire duration of your program. Our clinic takes your health very seriously, and there are certain metrics that can and will give us important feedback that other clinics and practitioners overlook. In our health reporting software, we record standard metrics such as weight and blood pressure and glucose readings, but we also want things like Bristol scores, carb tolerance, digestion transit time, and basal body temperature. In this software, you can also connect things like your Apple Watch or Fitbit so we can view that data as well, and you can also upload lab results from other practitioners. These numbers are important and they should be treated as such. This next part of the program is available for our in-clinic clients only. Once the above programs have all kicked off and you've had a chance to start making changes, we will then conduct our physical L&T exam. So what is L&T exactly? L&T testing uses your body's innate ability to be able to determine exactly what it is that you need to heal. Ever wonder how a fox knows what it is supposed to eat, or a bird, or a whale? All animals, including human beings, have the ability to know what our individual bodies need by using our central nervous system and our sense of taste. Remember that graph we saw at the beginning? Once I have the ability to go back to that graph and test things like your liver, your gallbladder, small intestine, even your brain, I will be able to find out exactly what your body needs. When you sit in the office and feel immediate relief from your ongoing back pain just by tasting a supplement, trust me, I'll know that at that point you know how important this process is in your journey. After reviewing all of your testing, I will design a supplemental program specifically for your needs and goals. This is perhaps the most important part of the work that we do and can change a person's life within a few short months. It is important to know that the recommended protocol cost is not included, as it is impossible for us to know what your body will need without doing the adequate testing first. A few important details regarding the protocol. I will never recommend anything that your body hasn't specifically told me it needs. If I tell you it's important, trust me, it's important. I only offer medical grade supplementation. I do not ever advise supplementing with synthetic vitamins or nutrients, as these could make your health much worse. 95% of supplements you buy off the shelf are synthetic. So this probably sounds expensive to you. You would think so, but I have the necessary licensing and qualifications to purchase directly from Biotics Research, which is the only product that I do testing with. I know this important process is directly involved in your healing journey, so I pass the savings on to you, to all full program participants. This means that each person is receiving the highest quality, real supplementation at a price less than what they would pay for a cheap product off the shelf or on Amazon. Chances are likely that the supplementation you are taking right now, if any, is doing you a lot more harm than good, and it is expensive. Again, the recommendations I give are solely because your body needs them, not for profit. And finally, we're coming to step number 10. So once we have identified and started to implement the recommended course of action, the following steps will occur. A new protocol evaluation, which allows you to report any and all changes that you are experiencing, is done every 3 weeks. A new NAQ assessment that will allow us to see which systems have improved and which still need work is done every 6 weeks. A new functional exam is done every 30 days if needed. New supplemental protocol. So each person responds differently with supplementation. The goal for each person is to reduce the amount of protocol needed as they start to heal. Some will need a new protocol month after month, and some will not need any at all. This depends on many factors, including your health status coming into this. Protocol is issued for 30-day increments, at which time an evaluation will be done before new recommendations are given. We will repeat these steps as long as necessary. Our program does not come with a time limit. Although the average person needs approximately 6 months worth of care to reach a level where we feel comfortable suggesting a maintenance program. The maintenance program means a client will be given suggestions on how to maintain their current health status and will not require any more office or virtual visits with our practitioner. A person is always welcome to schedule a follow-up visit. Our door never closes. As you can see, our program has integrated every possible health consideration and provides an unprecedented level of care, time, and effort to each person. Whether you choose the in-clinic program or the online program, it is an investment in your health and your future. Both are unmatched in success and quality. If you are ready to commit to yourself, go to our website and click on Get Started, or text me directly with any questions that you have. After you've signed up for the initial assessment, it will be at that point during your consultation where you will be able to choose whether or not you want to proceed in our full program. I hope this video was helpful and we'd be honored to be part of your journey. Thanks for watching.